Polluting generations. The consequences of pollution on intergenerational health and how it relates to poverty. Introduction. It was not only the children of women who benefited from regulatory reductions in exposure to air pollution during pregnancy, but also their grandchildren. It is well known that families living in poverty are more likely to live in areas with poor environmental quality, but the extent and severity of damage across generations lacks attention. Prominent scholars like Janet Curry and Patrick Sharkey have collected substantial evidence on the effects of pollution and other health determinants on the outcomes of children. Curry has expertly highlighted how these effects on children's outcomes can originate as early as in the womb. However, the unsettling truth is that the factors like pollution can cause much further reaching consequences on intergenerational health. Innovative research from the Washington State University demonstrates that chemicals can confer toxicity 4 generations after exposure by forcing permanent heritable changes in gene expression that can change the body's ability to metabolize and excrete toxic chemicals. The fact that a great-grandparent's exposure to toxic chemicals can lead to potentially permanent damage in an individual's health 4 generations down the line should be distressing. Due to the lengthy period in which the damage takes place, it becomes difficult to put into perspective. As a result, many mistake this issue to be non-urgent and prefer to limit their focus to more immediate concerns. While there are plenty of urgent issues to be addressed in poverty, this does not mean that intergenerational health and equity should take a back seat. On the contrary, if we want to better address poverty, we need to develop a stronger sense of urgency and focus on intergenerational health by broadening our perspective. This starts with addressing environmental inequity for those most affected, like children in low-income areas. As you now know, a single child exposed pollutes entire generations. Transferring pollutants. The ability of pollutants to be passed down multiple generations raises major concern for intergenerational health, especially for those in poverty. As explained in the article Across Generations, throughout our lives we build up toxins and pollutants that remain in our body and eventually are passed down from mother to child, a large portion of which can remain for decades or an entire lifetime until they are also passed on to their children. This does not solely occur during childbirth, but in fact, mother passes to her child an estimated 50% of her own body burden of persistent chemicals through 6 months of breastfeeding. This is made worse when the article explains how breastfeeding is practically unavoidable, as health advocates consider it the best food for babies, despite the pollution. With no equivalent alternative. Some of the common pollutants found in the mothers and daughters studied in this article are known to have severe consequences, like mercury and lead. In the tests conducted, 3 of the 4 mothers tested had mercury levels higher than the federal safety standard and lower levels of lead, which is still thought to pose a risk at any level and can remain in the body for over a lifetime. Although the study had a small sample size, the results were still very concerning, and data from the other studies supported similar findings. If pollution is allowed to increasingly build up in a family throughout generations, the risk to the health of every next child will grow. The families that are most likely to experience this effect will be the groups most vulnerable and disproportionately exposed. Pregnant mothers and their children are the most immediately vulnerable to the health effects of pollution. Pregnant women exposed to pollution risk not only their child's health, like low birth rate, preterm birth, and death, but their own health as well. Children are still developing and are the most physically vulnerable, accounting for the most environmentally related deaths per year. In fact, in young children, air pollution contributes to almost 1 in 10 deaths by respiratory infections, asthma, and congenital heart disease. Pollution doesn't just harm, but kills children across the world. An article about the effects of reducing air pollution on intergenerational health explains how the grandchildren of women who were exposed to lower levels of air pollution during pregnancy were more likely to attend college and less likely to drop out of high school 40 years later. Pollution shares its effect on the child's level of attainment with growing up in a poor household. Minorities and lower socioeconomic groups, which largely overlap, are the most disproportionately affected by pollution. Due to the marginalization of these groups, they not only have historically lived in areas with the worst environmental quality, but they are typically at the mercy of a system that prefers either classes of higher economic status or straight out ignores them. Public health policy is often criticized for giving in to economic self-interest. Curry explains how economic actors tend to undo policies addressing poverty and the environment. She also calls out how fetuses exposed to lower levels of pollution may also receive higher quality medical care, which further illustrates economic inequality. All of this serves to add another dimension to how intergenerational health must be addressed. Focusing on intergenerational health to address pollution and poverty. The term intergenerational health is broadening to encompass past and future factors surrounding environmental quality, education, economic status, and well-being, all of which also relate to poverty. By targeting pollution, we can ensure society will be healthy enough to take full advantage of each of these factors. Simply put, you can't solve for poverty without addressing the issue of pollution. Health is a human right that must be guaranteed for all, including future generations. Some economic actors might argue against more health and environmental policy, but I think a utilitarian would argue that if we focus on ensuring quality intergenerational health, there will be less people in poverty, and in the long run, more people will be able to contribute to the economy, therefore resulting in more benefit for everyone. By focusing on intergenerational health to address pollution and in turn poverty, we can improve the lives of every generation moving forward. It is important to acknowledge that this includes our own generation as well. But instead of narrowing our focus on the short term, we must broaden our perspective to reach past our own lifetime. If Rawls were studying intergenerational health today, he would acknowledge the inequity in weighing our own generation above others and come to the same conclusion under the veil of ignorance. This focus requires more research, more urgency, less economic intervention, and must be tailored to be effective for marginalized groups. This shift in focus is best outlined here. The weighting and assessment of intergenerational health effects would change the way we perceive and classify health threats. As the focus shifts away from temporal immediacy, targeting high-income age groups and economic efficiency toward long-term social and environmental dynamics for those groups who are relatively marginalized in the political spectrum. Accordingly, an intergenerational analysis would influence the valuation and thus alter the development and implementation of health measures. With the intergenerational shift and emphasis toward non-economic target groups, environmental and social health risks, whose long-term consequences only emerge over time, are recognized in the present, enabling timely primary prevention. Intergenerational justice remains, therefore, an efficient health measure for all those whose participation in society is limited or non-existent due to their age or because they have not been born. What is intergenerational health? Intergenerational health is a rising term that is beginning to take on a new understanding. In healthcare, the term has been used to refer to the social, physical, and epigenetic factors that shape the next generation with a single family. Intergenerational equity is also a term that is used occasionally in economic and environmental justice. And intergenerational justice, which refers specifically to the future generations to come. Intergenerational health is beginning to refer not just to families, but to society as a whole. Environmental justice and economic circumstance are both deeply interconnected to health, as things like air quality and socioeconomic status directly correlate to quality of life. Therefore, it is necessary for intergenerational to encompass this connection and integrate this idea into the overall health and well-being of society. Poverty is often accompanied by environmental injustice, and since health and environmental quality are so closely related, this means that by addressing environmental inequity, like pollution, we are effectively addressing poverty. While pollution may not be thought to be the largest component of poverty, it can be quite tricky and complex. Dangers and complexity of intergenerational pollution. A large part of the reason the effects of pollution across generations are so frightening is simply due to the long period of time these effects take place. Because damage can build gradually over years, it can often be ignored or go undetected by even the individuals affected. It is also difficult to gather data over such long periods of time. This, combined with the fact that intergenerational health is a topic that is only recently emerging, means there's a lack of research and evidence with the extent of damage resulting from toxins and pollutants. Another serious issue of pollution is that children are the most vulnerable to environmental effects when they are also at their most malleable stage. This means children are more susceptible to pollution and climate change, the health effects of which can have long-term consequences and significantly hurt the possible outcome of a child, as Curry's research suggests. The scary reality of toxins and pollutants is that they can be passed on from mother to child, some of which can stay with them until they have children of their own. So before a child enters the world, or even before their parents enter the world, that child can be predisposed to limiting factors to their health and possibly their children's future outcome. Because environmental inequity and poverty are so closely related, pollution also comes with some of the complexities of poverty, like marginalization for one. Environmental damage disproportionately harms the health of minorities, pregnant women and their children, and people in impoverished areas around the world. Inequities cannot be ignored when addressing poverty, and they must not be ignored when addressing pollution. Yet, as it follows, self-interest and economic motivation tend to act against policies addressing poverty and the environment. The fight against time. Intergenerational health and epigenetics are still considered to be relatively new compared to their scope of research. Trials tracking family health over generations obviously takes a great amount of time, but it also requires people who are motivated to carry on the research, as no single person or group will be present long enough to observe every generation. Since environmental damage occurs over the long term, people lack a sense of urgency about the issue. One article simply explains that compared to an acute infection by a virus, chronic and long-term environmental damage is less immediate and cannot be compared in its biological and physical ramifications. They suggest that the reason for this is due to the unequal weighting of generations. It is understandable how one might value their own generation over others, as it directly concerns them. But this does not make other generations any less important. In actuality, the struggles of current generations are often left by the previous one. This is where we must challenge our perspective, as each generation will see more benefit if we embrace a more proactive approach to policies. If instead we maintain a reactive approach to health policy, then by the time the damage has surfaced, it could be too much for one generation to handle, which will result in extreme suffering. Generational damage is not a new concept, but there is still a lack of comprehensive research on the issue. Economic stickiness or mobility in poverty is well documented, but even Patrick Sharkey says there are few data sets that follow sample members across multiple generations. Instead, data used to study generational trends has essentially been snapshots of an individual's status at childhood and then adulthood. The accuracy and range of this data can vary depending on the study, as Sharkey is actually considered in his research. But snapshots do not always tell the whole story. Studies that are more in touch with the participants tend to lead to more analysis by including social or gradual factors that are otherwise missed but play an important role in well-being. Sharkey emphasizes the need of studying effects over time by concluding that several descriptive studies have documented the persistence of neighborhood advantage and disadvantage over a long period of time and across generations, suggesting the need for a greater focus on the temporal dimensions of exposure to neighborhood poverty. This highlights a critical danger of how negative effects can compound over time, especially when it comes to poverty. More data and comprehensive research across multiple generations are needed to help inspire urgency and change perspectives.